Hello friends, welcome to my YouTube channel. In today's video, I will demonstrate how to perform hysteroscopic myomectomy in a case of huge submucosal fibroid. So as you can see here on diagnostic hysteroscopy, a huge 3 by 4 centimeter sized submucosal fibroid was seen. As a routine, always do not forget to perform fibroid mapping, which means you should always assess the lesion from its all the borders and you should finalize the plan of action. So here, as you can see, this fibroid was coming down from the anterior wall of the uterus and rest of the cavity was looking absolutely within normal limit. So there you can see anteriorly the attachment of submucosal fibroid. So on first diagnostic hysteroscopy, I thought that this can be even an endometrial polyp, but as the case progressed, the diagnosis of fibroid, which was mentioned on sonography, was confirmed looking at the consistency and attachment of the lesion. So let's start with our procedure. So after confirming the diagnosis and getting done with the fibroid mapping, now I have inserted the resectoscope and let's start resecting the fibroid. So as a routine, I always advise to check the resectoscope loop for its integrity, for the active power cautery supply, and then only you should start the actual procedure. So here, as you can see, rather than chopping off the fibroid in small pieces, I directly have jumped on the attachment with the uterine musculature. This is to shorten the length of our surgery, and as you can see, within a matter of few minutes, I will finish off this myomectomy procedure. So this was a very interesting case. As you can see, this was a submucosal fibroid which was mentioned on the sonography, but actually it also had intramural component which is falling down as I am cutting off the fibroid pedicle. So as you can see here, now only the mentioned size of fibroid is not to be resected, but an effort is to be taken to resect entire amount or entire mass of fibroid which is also present inside the uterine musculature. So the surgery would be incomplete if you do not resect the myometrial component of this fibroid, and hence I have decided to resect off the entire submucosal as well as myometrial component of the fibroid. Care here is to be taken to be within the safety range of myometrium. One should not excessively excise the anterior uterine wall, and hence it is always an ideal situation to have an intra-abdominal port in place before performing such complicated cases. Whenever in doubt, always have an external view of the uterus for the integrity of the uterine serosa. So as you can see here, I have almost resected entire submucosal and as well as the intra-myometrial component of the fibroid. And now, as you can see, after getting rid of the fibroid, when we started pulling it off the uterine cavity, it wasn't coming out because of its size, and hence now, as you can see on the screen, I am trying to reduce the size of the fibroid. This process will take another few minutes, and following which I will demonstrate or give a clear view of the restored uterine cavity. So as I have said, this fibroid was approximately 3 to 4 centimeter, which was mentioned on the sonography, but after entering the cavity and after chopping off the pedicle, more and more of the uterine myometrial component of the fibroid was dropping down, and hence this was approximately a 4 by 5 centimeter sized fibroid, which could not be delivered intact through the cervical opening, and hence using the same resectoscope technique I am now chopping off the fibroid component to reduce its size. So always remember, there are mechanical morcellators as well, which can be used effectively for getting rid of these fibroids, but I always prefer using the resectoscope because of their cost effectiveness and also the rapidity with which it will help us finish off our case. So as you can see, I have chopped this fibroid enough, and now using the hysteroscopic grasper I will get rid of this fibroid through the cervical canal. So always remember, the complete resection of fibroid and restoration of normal uterine cavity is warranted, especially when the future fertility is to be maintained. So after getting rid of the fibroid, this is the final picture. You can see entire of the uterine cavity has been restored. I hope you all enjoyed. Thank you.